Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all 3 parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is innate immunity. What is innate immunity? So this is the rapid response to pathogens, which is non-specific and lacks memory. It involves antigen-presenting cells, or APCs, for example, dendritic cells. It's often called, colloquially, the first line of defense against infection. There are several components to the innate immune system, some of which seem quite obvious but are often easily forgotten. So at a macro level, some of the key components of the innate immune system include the skin, mucous membranes, as well as secretions such as saliva and stomach acid. These are particularly important in the pathogenesis, for example, of nosocomial infections due to the breakdown of skin and mucous membranes, so for example, MRSA. Looking at the cellular level, firstly, there are phagocytes, for example, macrophages, neutrophils, and dendritic cells, and these are located at sites of entry, typically a resident macrophage. These use pattern recognition receptors, such as toll-like receptors. These are used to identify antigen motifs, also known as pathogen-associated molecular patterns, or PAMPs. After recognition of the PAMP, the complement cascade is activated, which kills the pathogens. Chemokines and cytokines are also released, which help to recruit adaptive immune cells, leading to the adaptive immune system being activated. After phagocytosis, antigen-presenting cells express pathogenic peptides on the cell surface, which can then be recognized by adaptive immune cells. So let's now have a question and a bit of discussion about the innate immune system. A 28-year-old woman presents with recurrent bacterial infections. Laboratory infections reveal normal levels of immunoglobulins. Neutrophil count is within normal range. The patient has no history of autoimmune diseases. Which of the following innate immune components is most likely impaired? So our options here are natural killer cells, the complement system, pattern recognition receptors, macrophages, toll-like receptor dysregulation. So the correct answer here is the complement system. And this is due to the fact that there are normal levels of immunoglobulins and neutrophil counts. And having deficiency of certain components of the complement system can put you at increased risk of certain bacterial infections. And this will be discussed more in the episode on complement. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.